We're looking at cervical arthritis. And when I talk about arthritis in this way, I'm talking about osteoarthritis, the arthritis that's just the wear and tear that happens to all of us as we age. The cervical osteoarthritis can become quite debilitating for people, given that they get a lot of stiffness and tension. That can also lead to headaches, but also leading to neck aches and creating some difficulty just holding their head up on their body. So as a physical therapist, I'm going to check first range of motion, see where the restrictions are. So I'm looking at what direction of range of motion is more limited than another. I'm also looking to make sure that there's no symptoms that are traveling down the arm. So I'm looking at numbness or tingling, any sharp pain that's traveling down the arm. In those cases, I'm looking more towards nerve impingement or a disc issue if there's traveling pain. Now there can be both things together, but looking at just neck osteoarthritis, I'm going to look at that range of motion and looking at posture, as well as the ability to be able to hold the head on the body. So I'm going to ask Patrick to just gently look down towards the floor. Generally, somebody that has arthritis in the neck, this range of motion generally tends to feel pretty good. It's a range that feels pretty easy to open up the bones in the back of the neck. Then as he comes to go up and looking backwards, that's usually where the discomfort is going to lie. He's not presenting in that way, but most of the time people that go through with having cervical arthritis are only going to move a few inches or a few degrees or so back and start to have some discomfort. The next things are going to be moving from side to side, so in our lateral flexion range. So as he bends his head from side to side, there can be pinching or strain on the side he's going towards, along with the pull on the side he's moving away from. The most limiting is cervical rotation range of motion. So half of our rotation happens between the skull and the first two cervical vertebrae. Then the other half of our cervical range is the rest of the cervical vertebrae, which make up a total of 7 in our cervical spine. So as Patrick moves from side to side, note that we need this range of motion when we're looking to back out of the driveway or turning to check for traffic or just walking and looking to look for cars. So that cervical range of motion can be quite challenging if there's a lot of arthritis. So the first exercise that I give patients are going to be things in lying down on their back. So Patrick, go and lie down onto your back, head onto the pillow. And so we want some support for the neck so that the pillow is not under the shoulders, but has it underneath the neck. And the first one is going to be cervical rotation. So Patrick is going to turn his head, so his left ear is going to land on the pillow where the back of his head is. So he's going to slide his head along the pillow and turn, and then slide the head back, and then do the same thing going over to the right. So as we do that rotation, the goal is to land where the back of the head was, and then come back to center, and then rotate the other way. By working on the range of motion lying down first, it eliminates gravity and allows for that movement quality to happen within the spine. And slowly doing that movement, a lot of times having a slicker sort of pillowcase can be quite helpful, but being able to turn side to side. Then we move on to lateral flexion, so side bending. So Patrick's going to keep the back of his head on the pillow and slide his left ear towards his left shoulder, come back to the center, and then slide his right ear towards the right shoulder and come back the whole time, keeping his nose pointing up towards the ceiling. So being able to keep that range of motion and work on it in a less grabbed position can be quite helpful to restore some of that range of motion, even though there might be some noises, there might be some areas that start to creak or anything, but if there's a little bit of noise without pain, it's okay to continue going through the movement. If there's any sharp, shooting, or electrical pain, pause the movement, don't move that far, or pause the movement that your body's not quite ready for that. So cervical arthritis.